2. Past performance is no guarantee of future results. Potential for loss exists in any investment.
So
Material is for
did I do a
informational
bad
purposes
job?
only. It
Did
is
they
not
say
investment,
something?
legal, accounting, or tax advice. A recommendation to buy, sell, or hold a
You watch it
security.
back.
No advice is given about a strategy's suitability for a particular investor.
Oh. I thought I expounded on the answers quite a bit. But no.
Ladies and gentlemen, you are now listening to the beginning of a new way of living. It's Younger Life.
That was completely off topic with Tylenol.
Welcome to another great edition of Younger Life. A beautiful day to
It is
be
a gorgeous
alive.
day. Good morning. It's beautiful outside.
It is
Oh, man.
so gorgeous. And I said to myself, first off, I'm Rick Federici.
I'm Mary Anthony.
And I got to tell you, it is absolutely wonderful right here on the Talk of the South Shore, AM 1420 WIMS, always streaming live at WIMSradio.com, that I will tell you, so gorgeous outside right now that it's going to be 70, 75, 80 as we move through the next week here in the Midwest.
That's what I keep telling the kids. You know, it's funny. This morning, one of my daughters came out in shorts and short sleeves, and I said, you know, it's nice, but it's not supposed to be that nice. Next week, that's perfect. But this week, I said, you might want to at least make sure you wear a coat.
I am
you know,
so
but it's
with
still,
you.
it's gorgeous. I love it. It's absolutely beautiful. And that helps everybody's moods. You know, this morning, my van, I barely made it by, time. You know, I like to be here early, and I barely made it.
You're here in the Younger Life Lounge, literally 30, 40, an hour. You're here like early daily.
Well, I like to be at least a little early because in the rest of my life, I'm not early anywhere for anything. But so I typically like to come here and be here early. But my van started acting up and actually overheated on me this morning, taking my kids to school. So the school is headed this way for me. So I had to turn around and go home and bring Jeremy's truck. So it's been a little bit of a ruckus morning. But you know what? The beautiful weather, I opened the moonroof and thought, just let the sun, it feels good. And
Let
it's okay.
the air
It's a good
in,
day.
baby.
That's right. It'd be a good day. So
It's going to be good. So I was really worried because when I got your text and you said, I'm having trouble, it went right to my gut because I always think of my ladies in my life or people that I care about, my daughters, my wife,
it's
just people,
scary.
anybody here on the team. Yep, absolutely. And I got to tell you, thank the Lord for small favors, keeping us all safe. I'm not throwing in prayer here, but I'm going to. Every time I pass someone, which is nonstop daily, anywhere I'm at, I constantly see flats, people pulled over. I always throw out kind thoughts to them.
That's it.
Or just a good
if you
mojo,
can't help, that
prayer.
helps.
Yeah,
you know
it
what I
does.
mean? At least send some good vibes that way. And
Can I tell
it's
you,
fine.
there have been times where I've been in the crazy construction zones, and especially now, Chicago, Indiana, Michigan, no matter where you're at, those of you listening online, everywhere, all over the
I was going
United
to say
States,
construction right now is everywhere.
where you get caught in those construction zones and there's no room and you're scared. People are zooming by you.
Oh, that would be terrifying.
And I have been caught at where you're almost in tears. And
Yeah.
I'm a man and I don't care and I'm emotional. I just lay it out there.
Yeah,
it's like,
that's scary.
I don't want to die.
Yeah, no, you don't want to get ran over. No, thank you. That does not.
I
sound
already
like a very
have
fun
red
way.
hair and I don't want the gel to mess up. People.
Oh, how funny! So
All right.
today we have a great show today. You know, it's every other Thursday we do Ask a Pharmacist. We have Jeremy today. He joined us. Not my Jeremy, but a real pharmacist.
That
from
would
the
be a
Port
good
Hospital.
Ask the Pharmacist. Yeah, do what you want.
Do you know it's really funny? Last time we did it, we had Jeremy the crazy.
What a nice segue into the real guy, the
That's
real
it,
man
the
himself.
real man.
The young Jeremy pharmacist. How are you, Jeremy? What's going on, buddy?
Hey, good morning.
Good morning.
Look at him. He's like, okay, back and better than ever. Listen, you were fantastic last time. And I know
Thank you.
It evolves, Jeremy, as you know, as we go through the hour. Folks, if you have questions you want to ask Jeremy, if there's things you want to throw out there, please, 219-861-1632. Even at the tail end of our shows this week,
Yes.
we were getting lots of popping questions. You
We
know what I'm
did.
saying?
We got one yesterday about aloe vera.
Yes.
And and also again to readjust sunscreens.
Right.
But aloe vera was one that I had forgotten all about until this morning. It hit me. Someone had called as we were ending yesterday.
Right at the back end.
So, Jeremy, could you tell us, as far as aloe goes, we'll start there just because it hit me this morning. I don't even know what made me think of it. It just popped in my head. What is the best use for aloe vera that you know of?
Yeah, actually, there's a couple uses that I know
Okay.
for it. Is that actually there's a concoction out there that you can actually drink it. It can actually settle some GI issues that you have.
Oh, goodness.
And I know that that's more in the supplement realm, so it's not actually like FDA indicated for it.
Right.
But there is some stuff out there, and I know that actually my mother's actually used it, and she's had some good responses for if you're having just some GI upset or maybe some bowel issues to try using
Wow.
the oral aloe vera.
So
But,
is that
obviously the one thing that everybody tends to use it the most for is for sunburns.
Right,
And
that's
there's
what I
actually one
imagined.
product, and I was actually going to touch on this because I know that I may not have talked about it last time we were talking about sunburns, but they use aloe vera for sunburns mostly is what I see it for. There is a product out there called Solar Cane, and it's
Okay.
the one that I recommend the most if somebody has a sunburn. What it is it has aloe vera in it, which is just really soothing. It's really good for the skin, so it just helps soothe the pain. But it also has like benzocaine in it. I believe it's benzocaine. It's what that is it's basically just like a numbing agent.
Yeah.
So when you're using Solar Cane, it has the soothing of the aloe vera, but it also has the benzocaine in it that's actually going to kind of help numb the area. So it's a fabulous over-the-counter drug that you can get. Again,
Yeah.
it's called Solar Cane, and that's what
Okay.
I recommend all the time.
I appreciate that. I'm curious, is that just my own, is that benzocaine the same thing as lidocaine?
Yeah, so there's actually a bunch of different canes,
Okay.
and they all work very similarly.
Okay.
Some work faster, some have a longer duration of action. Benzocaine is one that's usually used as a topical anesthetic. So that's the one that I believe they put in Solar Cane. There's a bunch of them, so it could even be a different cane.
Okay, I was just curious. So that is a good point. And that is the type of aloe vera I try to buy too. I'll see sometimes it'll have aloe vera with, I swear it said lidocaine once, but it's been a long time. But I do keep it in the fridge and stuff. I think that's a great
We
point.
do too. We keep
Yeah.
everything in our fridge. And I want to ask you, Jeremy, this question just came in based on the aloe vera question. Can we keep that for X amount of time? Like, for example, let's say summer was gone and it was from last summer or at the back end of the fall, let's say, and now we're X amount months later, 6-7 months later. Can we use it this year? Or is that one of those things where you don't really want to throw it out and get some new ones? Because I'm thinking, I don't know, and I'm not a doctor, but what do you say as Jeremy, the pharmacist?
Yeah, so again, with that being more of a supplement, there's not going to be really any good information out there specifically from the FDA or anybody else
Right.
about how it should be stored or how long you can keep it. So probably going to there may be an actual expiration date on it, but
Okay.
it probably doesn't mean anything. So if I had aloe vera from last year and I was going to use it on a sunburn, I would go ahead and use it.
Yeah.
And if it was working, seems how it's more in the supplement area, then I would just continue to use it. And so I think it's fine to use that if you had it left over from last year. So, and this is a great segue into expiration dates and
Yes.
what are they and what do they actually mean. And from an actual medical standpoint, FDA, what it actually means is that if I'm on a medication and it's 100 milligrams, it is guaranteed to be within plus or minus 10% of that dose. So 100 milligrams is easy to think about. That means that when I take that 100 milligram dose, it is anywhere from 90 milligrams to 110 milligrams guaranteed. And the expiration date just means is that it stays within that concentration until the expiration date. Once it falls outside the expiration date, there's no guarantee that it's at that strength anymore. There are some medications that can actually, as they decompose into a poison. A great example of that is tetracycline, I believe. Some of the cyclines can actually degrade into a poison.
Wow.
So there are some things that you need to know about. The cyclines are definitely a group of antibiotics that if it's expired, don't take it. Absolutely don't take it. But basically that's what an expiration means. So once we get out into a suntan lotion, it's not technically a prescription that you're getting from the doctor. And if it says that it expires this year and you're still using it, basically all that means is that it's not going to be at the potency that it was manufactured to be at.
Okay, so it would actually diminish, right?
But technically it could still work. So I know last time we kind of talked about it a little bit.
Yeah.
If I have something from last year and it's sunblock, I would probably use it. The compounds specifically in sunblock, they tend to decompose a little bit faster than other compounds.
Okay.
So there is a chance that if it is expired and you do put it on, then maybe it'll work fine, maybe it won't.
Okay.
That's great information.
Yeah, and again,
seriously.
I do know we touched base on that where you may need to reapply more often.
Oh, yeah.
I know we had discussed, Jeremy, last time you recommended most, read the bottles, but most of them will say 90 minutes to 2 hours or so, but make sure you're reapplying at that, pretty much at that rate. So maybe if you are using last year's, finishing it up, don't want to waste it. I get that. I do the same thing, but maybe reapply a little more often, especially to the kids. I think that's such a great point, and I'm glad you brought up that the cyclines are antibiotics. I wasn't sure what kind of medication. When you said that can become poison, that's scary business. I mean, a lot of us don't want to throw out, say, it's Tylenol or Motrin.
Sure.
You don't want to throw it out if it expires that month or something, and it happens to be a few weeks later. But obviously, if it was one of those antibiotics that can break down to a poison, that is terrifying.
Can I throw this out there though?
Yeah.
And I'm going to say this from my perspective. I know what you mean because I know a ton of people that will do that not only with medicines, Jeremy, Mary,
Yeah.
of course, Younger Life audience, but will do that a lot with food. And they'll be like, oh, it's an expiration. Who cares? But I will tell you, I am that person. I'm going to tell you straight out. I see an expiration date and it gets to that date, I'm dumping it. It doesn't matter to me. I know that may sound weird to people.
No one wants to be sick.
All right.
You know what I mean?
I'm like, I'm throwing that bad boy out.
Yeah.
I'll go buy something else.
Yeah.
That's just me because I guess that's in my mind as a guy my age, but I'm with you on that.
I'm glad he brought that up. I think that's
yeah.
important, especially that some medications can break down to a poisonous level. That's very scary. So all the more reason to honor those. They are there for a reason,
Can I throw this out there too? We had an instant text, Jeremy, and it was all about dry hands. It was a local hairdresser that loves Younger Life, uses gloves to do coloring and other things with the hair. Primarily, that's their job. So they're coloring, they're using chemicals. They do use the gloves, but their hands are super, super dry. And they use like cortisone and some other things that have been told them to use. They use lotion, and I'm reading this text, it was very long, but in a nutshell, is there anything you could recommend as a pharmacist or something that they could try? They've been to the doctor, just kind of what your thoughts are on that, whether it's a vitamin, whether it's something that can help their hands, because this is their livelihood. So obviously they're going to keep doing this for a living. Can you kind of maybe expand on that if you wouldn't mind?
Yeah, there's actually so many products out there that are for hydrating skin. Some of them are alcohol based, some of them are more of an oil based, and it's really going to come down to preference. The one that I usually recommend the most, and as a pharmacist, you get questions a lot with sensitivities and sensitive skin. So the one that I always push people to is towards Cetaphil, which is a very there's not really any additives or anything in it, so you're just getting like a pure moisturizer. It can be unscented. If people have sensitivities, I always point more towards an unscented version of it. But even within the Cetaphil line, there are oily based ones, and there's alcohol based ones. I don't like to have that oily feel after I apply stuff,
Right.
so I tend to go more towards like an alcohol based a lotion. There's some balms out there that some people like. Ultimately, it comes down to preference. I always point somebody to Cetaphil. As far as using like cortisone, cortisone is actually a drug, and it's used in the hospital. It's used, for a lot of things, and it's actually like a steroid. It's a topical steroid that you put on the skin, and I always think it's really wise to not use that all the time. So a steroid can actually break down some of the layers of the skin, and if you use it for an extended period of time, it can actually damage your skin. Well, it could be a permanent damage.
Yeah.
So whenever somebody's talking about cortisone, you can use it for a while. Now, there's some people with some skin diseases like eczema, where they have a thicker patch of skin, and it requires that that steroid on there for extended period of times to soften it up and cause that to go away.
Thank you,
For
Jeremy.
like
That's
just
great.
general dry hands, I would not use cortisone, hydrocortisone, any kind of cortisone for extended period of time. I would only use it maybe max for a couple weeks.
Thanks,
and then,
Jeremy.
And then I'd be off it for a while.
I have to tell
That's
you,
great.
your information, you're on fire today, Jeremy. You are just, honestly, that is awesome information.
Do you know, I do want to clarify
Never knew
though,
that.
you said that Cetaphil, is that in the pharmacy department then someone would search for it rather than by the regular
Great
lotions?
question.
It is. It's going to be in the pharmacy, but it's going to be in a lotion section. People like Neutrogena. There's all kinds of products out there.
Right, Sure.
You use a product that you like. If you have sensitive skin, I point you towards Cetaphil.
Okay.
If you go to Kroger's, they're going to have a generic brand of it. I'm sure Walgreens and CVS have a generic brand of it also.
Okay.
I would just, if Cetaphil is what you're looking for and you want the generic, just look for the generic one, and it just says as compared to Cetaphil. Probably
Right.
states it right on the bottle.
Right. I think that's great. Though.
Awesome info.
And that's why I wanted to verify, you're not just going to go to the lotions, so I think that's perfect at the pharmacy. And it's worth a try. I mean, it can't hurt. And that's why pharmacists are such a great resource. Obviously, one product doesn't work for everyone. But I realize, too, I see it myself at Walgreens or CVS or any of the pharmacies. There are so many people that have just general questions like that, that are constantly challenging these pharmacists. That's why I think it's such a fabulous resource to be able to use.
And that's why I think this is a
appreciate that.
fabulous piece with Jeremy.
I love it. I do.
awesome.
While we're talking about skin, this is a funny one, but
Hey, can I say one more thing
Please,
about
please.
suntan spray? We talked about that 2 weeks ago.
oh yes,
The question, I actually misunderstood the question and thought we were talking about sunblock that was in a spray. But let's talk about suntan spray for just
Yes.
a moment. 'Cause I actually did some research and looked into
Okay.
it and found that the main component in that is DHA. It may not say DHA on the bottle when you're looking at it. It's dihydroxyacetone is what you might want to be looking for as an ingredient. Basically, how it works is that when you put it on your skin, it stains proteins and amino acids in the dead layers of your skin, and so it caused it for you to have a bronze look. So it looks like you have a tan, but it's not going to give you the same protection as like a real natural tan would actually give you more protection. But it was FDA approved in 1977
Wow.
in a lotion. It was not approved to be used as a spray. So there are some popular like spray tan booths,
Yes.
and specifically for those, the FDA has put out a warning that inhalation of this chemical DHA can actually lead to lung cancer. I would consider that probably like long-term exposure. So if you just had one day where you're like, oh, I want to have a nice tan and I want to use a spray tan, I would think, a few applications in your life probably won't harm you. the one thing is I wouldn't do it in a spray booth. I would do it in a well ventilated area if I was applying spray tan to my own body. I don't use spray tan. I actually would never recommend it to use. But if you do want to use it, there's some information for you.
Well, that is great information.
That's great information. So I just want to clarify. So spray tan,
Yes.
a lot of us, and I got to
Well,
tell you.
the question was, someone had actually
Right.
asked us to, a couple weeks ago, if those were FDA approved
Right,
to
the-
do
the actual bottles, right?
Well, they were talking about, just like Jeremy said, that was exactly what they wanted this
Right.
time. They were wanting to know, you see not just the booths, but you can also buy, like you do it yourself tan.
I have tried that because
personally
I
would
can't.
not. I would turn orange.
No, but that's what happened to me.
I
I
can't
did turn
imagine.
orange because
Oh,
of the pale
buddy.
skin. I only did it because I have to watch my skin. I have my skin checked for cancer every
Yeah.
6 months. So I was telling you this with the freckles and stuff.
Mm-hmm.
So I tried to apply it and I instantly turned orange. And I said that the one time I tried it.
Yeah.
But the other side of it is a lot of people that are in my position or people that just want to, let's say they're going through medical stuff or they just want to have a tan look.
Yeah.
They go to the spray tanning booths.
Yeah.
So that was the question I wanted to ask them.
And I think that's great information,
Right.
Jeremy. I appreciate that. And I appreciate you backtracking on that just for that listener that was curious about that. So FDA approved, yes, in the 70s, which clearly research has come a long way. So I don't know if they've still checked
You weren't even
that.
born. Get out of here.
Oh, please.
All right.
Anyways.
Let me ask this question. So tanning beds and stuff, and we don't play doctors, and
Right,
we're just saying
and-
it's your choice, just so we're very clear. But I would personally stay away from tanning beds. Correct on that, Jeremy? But you're saying spray tanning. I know there's the spray, but then there's also the tanning
Yeah,
booths.
yeah.
So do you say stay away from those in your opinion? And we're not going to hold you to, but just,
Right.
what is your thought on that?
Yeah, so let's first start with, so the sun has two different types of rays usually that we're worried about. There's UVA and there's UVB. UVA doesn't penetrate very deeply into the skin, so it's less dangerous. It's probably more likely to cause an actual burn. And then there's the UVB rays, which penetrate more, and we're probably more worried about that actual ray causing cancer.
Right.
I believe that suntan beds have more of a UVA range as far as that goes for tanning. However, there are many documented cases out there of people getting skin cancer from using suntan beds.
Right.
So I absolutely do not recommend the use of suntan beds. I never will recommend it. One more segue. This is going to go back to suntan lotion. I'm so sorry.
No,
But,
don't.
Please. This is what the
when
show's
you're buying a
about.
suntan lotion, you want to make sure that you're buying one that's broad spectrum because that's going to be
Good
covering
point.
the UVA rays and the UVB rays. So always when buying a suntan lotion, make sure that it covers all the rays. It's broad spectrum.
Good point.
Suntan beds, don't ever use one. They can cause cancer. There's a lot of documented cases. I know somebody right now who is in his final stages of cancer. Started off as a skin cancer and now it's everywhere. And he used to use a tanning bed all the time. Please
Wow.
stay away from tanning beds.
That's a good point. I do have a question though about the sunblock. It just occurred to me when you were talking about broad spectrum, which is very important. Is there a difference between children's sunblock, the sunblock that's geared specifically for kids, or just regular sunblock for anybody? Is there a difference? And should we certainly be only using the children's ones on our children?
Yeah, that's a great question, and I'm not 100% sure.
I'm sorry, that one just,
there
just
might
popped to
be.
me.
I'm just guessing that they are probably the same.
Okay.
I would be using a child version on my kids.
Mm-hmm.
They might have less preservatives or other chemicals that are in adult ones that make the product last longer or something like that. So
Okay.
whenever there's an option to use the kids version on a kid, I would use it for that fact alone. I mean, we're exposed to so many chemicals every day in our life that I feel like it's my job to try to reduce the exposure of chemicals, not only on myself and my kids, but anybody who talks to me and asks questions about it. I'm a pharmacist, but I'm also very much a naturalist. So very much you try to use as little chemicals as possible. I try to buy organic vegetables. the more chemicals you're going to be exposed to, the more chances that you're going to have of having all kinds of conditions.
Well, I think that's a great point.
I always try to minimize chemicals in my kids. I would always use the child version of a suntan. I actually prefer trying to cover my kids up. So if we're going to be out in the sun and we're going to be running around, I'm going to try to have like a little kid's hat on them. I'm going to maybe have a long sleeve shirt on them. Or if they're just running out and having a good time, I try to limit the time that they're out there so that they're not even burning, but I'm also not applying chemicals to them that much either. But there's obviously times where we go to the beach or we go someplace and they're exposed for a longer period of times. And in those cases, I absolutely believe I should be using suntan sunblock. So I don't know, that's my 2 cents.
Yeah, I think that's a good point. I liken it to the discussion that we had last time you joined us about the percentage of DEET in the bug spray. So, you said if there's children's bug sprays, that's why it's important to use geared towards kids for kids, because the percentage of DEET is lower. And I was just curious if it was the same with sunblock, but I'm in total agreement with the kids. I prefer, a lot of times I buy only children's sunblock and I use that on me because that's what I have.
You're a big kid at heart.
I am. But that's what we use. So that's good. And now I promise, I know so many of these are opinion questions. I'm going to try to get to some medicinal, much more traditional
I have lots of opinions, so.
Good. I love it. Me too.
Hold that thought, because he mentioned organic, and I want to throw this out there to our Younger Life audience before we get to the next question. And please keep them coming in. Dirt to Delicious is coming up this weekend. Mary Anthony will be out there with the production crew, 10 to 1 on the lawn of the LaPorte Hospital, 1007 Lincoln Way in LaPorte, Indiana. We would love to see you out there. All types of freebies,
hands-on gardening,
workshops. I love
plot your spot.
The
That's
lettuce,
cool.
LETTUCE. When Jeremy mentioned, organic, I'm thinking, Sasha G. Burns is going to be absolutely phenomenal.
She's awesome.
Anyways,
so it's
back to
lots
the
of fun. Okay, so this one's more or less about getting those owies outside. So obviously we're outside a lot more this time of year, and it happens every day. I mean, someone falls and gets a skin knee or something else.
Absolutely.
If you when we leave the house, say we're going for a bike ride or we are going to go hiking or something, I always bring a few Band-Aids with, just because, someone inevitably falls and bleeds. It's just the way it goes. So is a bandage sufficient, sticking a quick bandage on it, or is there a quick, convenient way that we should be cleaning it prior to putting on that bandage that we could carry with us, something quick and easy like that?
Yeah, so I would say that if you fall down and you get a scrape or you have a cut and it's you or your child, that you at least want to clean it to some extent. So what I would use is I would just clean it with any kind of water source that you have that you can clean it, particularly though from a faucet, because when the water comes from the faucet, that's either coming from the city or it's a cleaner version of water. I don't know that I would just wash it off in the lake or in some other source that just may or may not be clean. It also may just depend on like where did you get the scratch at. If they're running around and you're in an amusement park and there's germs everywhere, I would be more specific about trying to maybe seek out something to clean that wound out with. But our bodies are so good at fighting off bacteria and viruses and healing is that I always feel like that you can just leave it up to your body also. So I don't carry anything extra around when I go out with my kids or anything like that. If they scrape their knees, I actually prefer not to put anything on it.
Okay.
I know there's a lot of people who may carry around like Neosporin in their purse or in their pocket.
Yeah, that's what I was curious.
Which is absolutely fine. I think it may actually reduce the heal time a little bit if you're using Neosporin or things like that. But I really don't think any of that stuff's necessary unless you have a chronic condition, which is actually a good topic to bring up. Like if you have diabetes or things like that. So an example is my grandfather, who's not with us anymore, but he had diabetes and he had stepped on a nail somewhere around his house and didn't even know it. And so along with diabetes, you also get like maybe some other conditions like numbness. You may not be able to feel your legs. The legs is the big one. Is people can't feel their feet anymore. Well, he walked around with this puncture wound on his foot for a while and didn't even know it. Well, it actually he ended up having to have it amputated.
Oh
So
my gosh.
if you have specific conditions like diabetes or you have numbness in your feet and things like that, I think it's more important that if you are out and say you're at the park or someplace, when you're done, check that person over, make sure they don't have a cut someplace that they can't feel or that they don't know that it's there, so that you can actually keep an eye on that,
Yeah.
clean that, maybe use some Neosporin on that, bandage it up well, make sure it looks like it's healing okay. As far as for your little tykes running around, their bodies are basically the prime of their lives. They're fighting off viruses and bacteria. You can go ahead and let it heal. If it's got visible debris in it, rinse it off with water and put a bandage on it. Perfectly fine.
Okay, good. That's good to point out. Can we kind of touch base a little on the difference between prescription medications and over-the-counter medications? Like just in general, I think is what they were meaning. I'm not sure if they're had a specific medicine.
I feel like I may have touched on this a little bit 2 weeks ago, but
we did
but
a
really,
little bit, yeah.
basically a prescription medication is something that is deemed that a physician needs to follow you with to use it safely and effectively. There's a lot of drugs out there, like, for example, statins, where
Yes.
it can actually, it can affect your liver. It can affect your liver over time. So, like, it's a good idea that if you're going to go on a statin to have a baseline liver function, and then follow it up after that 6 months later to see if there's been any change. And then after that, they might require it yearly or bi-yearly. But there are known issues with drugs that a doctor needs to watch to make sure that that side effect or that issue isn't happening to you. Okay. As far as an OTC medication, they're safe to use on your own. There's always a couple helpful hints to know. Like, I know I touched on Tylenol 2 weeks ago, acetaminophen, a generic name. Also, like Prilosec, things like that. It's only recommended to use for 14 days without seeing a doctor. So even though it's over the counter, it's only indicated for those two weeks. If you need to use it longer than that, then you should probably go see your doctor, because maybe there's another issue, or it's good for you to be monitored while you're on that medication.
Good point. That's what we always say too. Call your doctor. Anytime you're on a medication.
And what are we not, Mary Anthony?
We are certainly not doctors. So
Jeremy, here is a great question, and I am not familiar with this at all. And this came as a text. Someone listening, of course, in LaPorte, Indiana, at work, and they're actually watching us on YouTube right now. The question had to do with this new charcoal supplement. I've never heard of this, and all they said was, "Can you please ask Jeremy?" This is buzzing around my family. The charcoal supplement. Is there something that is a charcoal supplement, and what is that? Because I am not familiar with it, and I'm just asking a question that was texted over.
So there is, like, charcoal can be used for several things. Like, I know they'll use it it's basically an absorbent. So, for example, my wife, we have a bunch of kids' clothes and we put them in mothballs. And so technically you can use a form of this charcoal, and it's supposed to help draw out the smell of mothballs. So my wife ordered some of that, and we're trying that now. They may actually use that to help induce vomiting or things like that.
Oh, goodness.
Charcoal's great for things like that. As far as it being just a natural supplement and somebody just taking it every day, I don't have any recommendations for that.
Okay, yeah.
Because
no
that's actually, again,
question,
supplements are not really typically FDA regulated, right?
If it's in a supplement category, they can put whatever they want in there. I do know that they may use charcoal for, like, nausea and vomiting. There are some charcoal caps you can use, but to me, that's not really a supplement. It'd be something that you would just be using, a couple times here and there just to get you through.
I've never heard of such a thing.
That's why I asked that question.
Yeesh.
That's why I said, well, that's good to know. And I'm glad that he brought up, and obviously I'm glad Jeremy had some knowledge, at least on something, because that probably was an eye-opener for several thousand people in this audience.
Oh, certainly.
You know
I've
what
never
I'm
heard of
saying?
that.
So.
It sounds I think of charcoal grills. I think
Well, that's the first thing I thought of when I said charcoal.
Oh my goodness, that sounds like poison. It sounds like poison, but
Right.
I've never heard of that.
If we can get a specific name of what she's actually looking at, then I can actually do a little bit of research and we can share more in 2 weeks.
Oh, that would be great.
Beautiful. I like that. Thank you.
Yes, listener, please send that to us and we'll pass it along to Jeremy. That's great. I appreciate that. I have a question about specifically Benadryl. The Benadryl that I buy for if my kids are I have a couple kids with allergies, and I usually don't give them Benadryl. They take more of a preventative thing. But if it flares up or they are really having a hard time, Benadryl makes my kids sleepy. I don't like to give it to them unless it's in the evening. But I had my oldest daughter. Okay, my bottle is children's Benadryl, so it's a liquid Benadryl. It's recommended up to age 11. My daughter, it was my oldest daughter, she actually had a skin reaction to, we don't really know what, it was just small. It started off just a little bit of itching, and we had been camping, so I thought, oh man, maybe she got in some poison ivy, but she actually never had a rash appear, but it was really reddened in a few spots, like more in the neck area.
Sure.
So clearly something irritated her skin, and it was driving her insane one night, so I said, you know what, let me read the bottle of Benadryl, and maybe I'll give you some of that, and it will help at least reduce that puffy and the puffy red skin that had, it was like hives in a sense, but there were no actual bumps. So anyway, it said only up to 11, and she's 15. I did actually call the pharmacy to make sure she could have it, because I was more or less concerned, but I don't know, how would you, without calling a pharmacist, is there any way a parent could actually figure out that dosing on their own, or would you recommend as a pharmacist, it's probably best to just call the pharmacy or your doctor? For me, it was at night. That's why I called the pharmacy. But what would you recommend there, Jeremy?
Yeah, so to actually be honest, I don't remember the milligram per kilogram dosing for Benadryl. Mm-hmm. If I see a dose, I know what's not a good dose for a kid.
Right.
But I think using the age range on the bottle is perfectly fine. The reason why that only goes up to 11 is because once a child gets that old, and Benadryl is an OTC and it's not really needs to be washed, or it's really that dangerous of a drug. Once a kid turns 12, they just flip over into the adult dosing range.
Okay.
So the adult dosing range is going to be 25 to 50 milligrams every 4 hours, 4 to 8 hours. It can be almost, I wouldn't do it any sooner than every 4 hours, but you can use any kind of interval that you want. If you take 25 milligrams and there's not a response, then you can give 25 more milligrams before that 4 hours. But I would stay 50 milligrams every 4 hours would probably be a good place to maybe not go over, unless you're directed by somebody else to do so. Yeah. I do know the adult max dose for Benadryl is 300 milligrams a day. So for sure, I wouldn't go over 300 milligrams a day for somebody who's 12 or older. If you're less than 12, I don't know the daily limit for a ped right off the top of my head, or a kid. But I would just go by the age range on there. I do know that when I look it up on an actual drug resource, it just gives a dose for the age range. Okay. I don't have a milligram per kilogram strength. I could probably find one if I looked more in depth into like a specific pediatrician medication handbook. Yeah. Which I can surely do if somebody really wants that information for 2 weeks from now.
Well, I think that's great information right there. I am curious though, when you're talking about age guidelines, lots of medications have age guidelines when we're talking kids medicines. Sure. And weight guidelines as well. Is it best to use your child's age or your child's weight? I've always assumed weight is better than age, but I want to make sure that that's right.
I would say that in most cases, it probably doesn't matter. Now, really? If you have a child who is outside the typical age range, being either too heavy or too light, then it would probably be more accurate, and it would be better to use a milligram per kilogram dosing. But here's the thing about a milligram per kilogram dosing is that I don't feel like the average person knows that 1 pound is 2.2 kilograms, and they know how much their kids weigh in pounds, but not in kilograms.
I
They have
see.
to make that conversion. And then once they make that conversion, they have to make another conversion for how much they actually need, taking, oh, well, if it's 10 milligrams per kilogram, like Tylenol is for a kid, I now had to convert their weight to kilograms, which now they're 20 kilograms times 10 is 200 milligrams they can take every 6 hours. Well, there's a lot of converting in there, and
A lot of room for
I've
error.
been doing it forever. So
Yeah.
like for me, it's second nature, but to the average person, it's not going to be second nature.
Certainly.
And they may not recognize when a dose seems like it's high, because lots of times I can just look at a dose of something and go, we better check that out because it's probably too high, even if I don't actually know what the max dose is for that medication.
Okay.
But so I would say that if your child is in a regular weight range, normal, then the age is going to be fine. And in fact, if you do the milligram per kilogram calculation, that's probably where the age range calculation came from. And if you do it, it's going to be really close to the age one. But of course, it's going to deviate further away, or it's going to be different the further away from that average weight you get.
Okay.
So then if I have a kid who's 2 years old and they're only 8 pounds and they should be 30, you should probably be using milligrams per kilogram.
Okay.
All right.
I hope I
that.
explained that well. If I
No,
did, I
it's
can clarify
great.
it further.
No, it's awesome.
That's
Here's
good.
here's one where you're going to probably need a pen and paper there, Jeremy, our pharmacist, because I don't know how to say this word, and I'm just being honest. But this is a great question. Could you please ask the pharmacist about Garcinia, Garcinia, and it's Cambogia. It's Garcinia, like Cambogia, as an appetite suppressant. This supplement is all over the news. Just curious. Did I say that right, or am I way off on that?
I think you're as close as I could be on it. So,
Okay, thank you.
Absolutely, I've actually, I have read up on it a little bit. That again is out in the supplement range, and I can't give any like real medical guidance on it.
Okay.
It probably does work. You can try it. It's probably it's not
Right.
going to hurt you. Again, it's in the supplement range, and there's going to be very little backing to it, no FDA approvals or anything like that. The thing is with these supplements is that people have been using them for up to thousands of years.
Yeah.
For like certain indications. But the thing is that with medications, there has to be scientific evidence. There has to be studies for these medications. For some of these supplements, the reason why there's no studies on them is because you can't really patent that kind of a natural supplement that anybody
Right.
can grow or make on their own.
Well, and I would
So
imagine
that's
it's
why
so.
their studies aren't done on them.
I'm-
That doesn't
I'm-
mean that they don't. That doesn't mean they don't necessarily work, but it just means that I can't give you medical
Right.
hard literature that says what it does or not does. Now there are a few out there that they have looked at, like St. John worts. I know
Yeah.
St. John's wort you can use for depression. It actually may work just as well as the antidepressants that you can get from your doctor, but there's other research that hasn't been done on it, like what are all the side effects, what are the interactions with other medications. So even though it might work well, and there's some studies that may suggest that it does, I would still not recommend it necessarily.
Right, I understand. I imagine regulating would be very difficult for that in general, due to the fact of it's hard to test things that are so varying. I am curious, though, Jeremy, could you tell us who decides whether a substance is designated a drug or a supplement? Who's
Awesome
in charge
question.
of that?
Awesome.
Well, I'm going to say it's probably the FDA does do that. I mean, of course, you're going to have these drug companies that are making drugs, and they have to apply for FDA approvals to actually start developing a drug. And there's multiple steps they have to go through to. Sorry, my ear thing's falling out.
Oh, you're fine.
Push it in,
But
Jeremy.
there's just multiple steps they have to go
Power through.
And then once there's actually a patent on it and they've done all the research on it, then it's going to go out as an actual medication or a drug. The FDA is a short answer,
Right.
and there's a lot to it.
So if someone is curious about these supplements, is there a website or a location that you could recommend that someone possibly read up for as much as they can on their own, considering that these are not FDA approved supplements? Is there a location that they could at least do their own research a little bit?
Well, there's actually something called a PDR, it's a physician desk reference.
Okay.
And they actually make those for supplements also. That's a hard book. I'm sure there's a place that you might be able to find that information on the internet. That would be my initial recommendation. Now, of course, pharmacists have references that they can go to that are specifically for dietary supplements that may not be easily accessible, or they may cost a lot of money to have a subscription to per year. So physician desk reference, I bought one. There is a pdr.net, I guess, that you can go to.
Oh, okay. Yeah, I assume there probably was when you said that.
I might start there.
Okay, good.
But just trying to use Google, just trying to find it's so hard to find a good website. Hey, this is falling out, man. It's hard to find a good website on supplements, or to know that you're looking at a good website. Yeah,
that's it. I feel like I kind of feel skeptical. I'm always afraid someone's just trying to sell me on it. Now, we do have 2 listener questions that I don't. They're kind of funny, I think.
Wait,
I want to make sure
smiling.
we get to them. Well,
Are
last time they were on our
correct?
list. Well, they are. Last time they were on our list and we didn't get to them. And so I want to make sure that I at least address them. One wants to know, she wants to know what product you could recommend out of the pharmacy department to help fade stretch marks. She says she's tried everything. And
That's a great question, though.
She'd like to know if there's something you would recommend if someone literally were to come to the counter and ask.
Because the ladies get that sometimes from pregnancy, and there are other people that get it from just other losing weight or growing. Yeah, that's a great question.
Yeah, so this question can hit home some. I actually have some stretch marks, and nobody likes the way they look, but actually there's really no way to get rid of them. You can only maybe reduce their appearance by using some type of lotion that helps even out, hydrate the skin. The one that I always hear recommended the most, and that because of that I tend to recommend the most, is going to be Palmer's cocoa butter. Is probably the one that you hear the most. My wife actually used it during her pregnancies, and she doesn't have a lot of stretch marks, so I think it worked pretty well.
Good.
And now I'm talking about her, so I'm in trouble. She's not going to watch this anyway.
That's funny.
I would recommend that.
Okay.
So basically what a stretch mark is, it's actually like a tear in one of the dermal layers.
Right.
But it's kind of like a tear in a tendon. Once you tear a tendon or a ligament, that's it. It can't really repair itself. So that's why you have to have surgery to repair ligaments in your knees once you break one, is because they can't physically repair themselves.
I see.
This subdermal layer is very similar to that. Once it tears, there's not a whole lot that you can do about it. I recommend Palmer's cocoa butter because it has elastin and collagen in it. They also say that maybe vitamin D oil can help too.
Okay.
What makes elastin and collagen good is that those are the building blocks of that dermal layer. So if anything's going to help, it's going to be those 2 compounds probably. But I don't know of any product that actually causes stretch marks to go away. I haven't found anything. I haven't heard anything about it. I have actually just done some research on Google, just reading around, where there is a physician who does offer some kind of a micropuncture procedure.
Yikes.
That actually basically damages that area. It'd be like getting a cut, sort of, but it's on a micro level where it causes that skin to heal and reduces the appearance, may even completely reduce the look of that stretch mark. So maybe there is a treatment out there that does fix stretch marks. It's probably pricey, and it seems like you'd have to go to a physician for it. I don't remember specifically what the procedure is called, but I can relook that up and give that information.
Can I ask a question? This just came in with this in conjunction. Does alpha hydroxy acid help? Can you describe that? And that's a question from a listener. and a viewer, obviously.
And along with that, there's products like Mederma or whatever, you see commercials for. What's different about those then? Those kind of products, like this
Great questions,
alpha
everybody. Thank you.
hydroxy acid and products like Mederma. What do they claim is different?
Awesome question. Let's do that in 2 weeks.
Okay.
Okay, that's perfect.
We love this.
I've heard of Mederma, and there's a big. They say it works, but again, this is more like out into the supplement area, maybe where I don't know that there's any.
I was curious if there were any
out there,
that's it.
But I can actually look for specific papers about it to see if there's any actual scientific evidence that it actually.
Aren't you happy that you're here with us on Younger Life? Because
and we pick and pick. I'm sorry.
But here's the thing. He actually has to do homework.
I know. I'm sorry. I feel so bad over that. The last one that I like to try to address, if it's when we can, because this one they actually mentioned a vitamin deficiency. So I'm not sure if this is going to be an easy one or not. But are you aware of any information that could suggest that a vitamin deficiency could be blamed for gray hair? And why I loved that one is because I think, is that really true? I don't know.
It's called having kids and stress.
That's what I say. I say, isn't that just normal? But when we got this question, this has been a while back. I loved this question because I think it's funny. It affects all of us.
And in 1 minute, Jeremy, give us that answer.
Do you have? Yeah, is that one we should just postpone?
It's okay. There actually can be a link to a vitamin deficiency. It's one of the vitamin Bs.
Really?
So, but you really have to look at how old are you when you have gray hair. Mm-hmm. The thing is that it's a natural process that occurs. So here, let's look at a hair follicle. Has several different cells in it. They have one cell that actually produces keratin, which is it just keeps building that keratin up until it pushes out of your head and you have a hair follicle. And there's another cell called a melanocyte. I don't know what the other cell's name was, but the melanocyte actually gives it the pigment. So when the melanocyte makes its pigment, which is the same thing that causes us to tan, it gives it to the other cell that produces the keratin that produces the actual hair.
Wow.
So what happens is that over time, I mean, we can really go into the whole aging process, but basically
no.
It's through environmental factors. We're exposed to all these chemicals, and we have these in our bodies. They destroy other compounds, so they're destroying our cells.
Okay.
So that's one reason why I'm big on just trying to be as natural as I can be, because I don't know what that chemical is or what it actually does.
Right.
But if it's harming me in any way, then I just try not to use it.
Great point.
Also, your DNA has all this extra stuff at the end, and every time your cell is regenerated, or it splits off into a new one and the old one dies, all that extra stuff gets shorter.
All right, hold that thought. We're going to see you next time.
Yeah.
Thank you, Jeremy. You're awesome.
You are so awesome. We'll see you in 2 weeks.
Hey, we'll finish it later.
All right.
AM 1420, WIMS, Michigan City, a Girard Media Company station.
CBS News. I'm Steve Kathan. Debris has been found in a search area in the Mediterranean Sea. It's believed to be from Egypt Air Flight 804 that went down on the way from Paris to Cairo with